I'm Padmini, known as Pat, many of my friends and relatives. I'm 70 years old. I know many tell me I don't look it, but anyway, I am 70. Worked in the bike shop, and I really enjoyed myself. I was doing accounts, met some very nice friends, racers, and it was a fun life, I should say. Before that, I was actually in the bank, working in the bank. I retired, out of the optional retirement. I think at my age, I've done pretty well doing all that, and I think I'll still like to do, if I can find that kind of job. I lost my husband in 2002. That was a big tragedy. It was a sudden death. Healthy man, went to work, came back in a coffin. Was it a shock? Yes. I fell down. I lost myself for a few days, in fact, for a few months, in fact. Then I said, okay, next one. I've got 2 children. They've lost their father. They can't afford to lose their mother. Mother has to be strong for them, and they got a long way to go. Both were still, one was working, one was studying. Don't you think I need to be there for them and show them that life is full of challenges, but if you face them head on, you can get over it. There's nothing in this world that you cannot overcome if you put your heart to it. That's what I've learned throughout my journey in life, from the day I started my life as an adult. I had a dad who gave me all the courage. In fact, all this courage I had then, I have even now, is from my dad. He has always told me that hold yourself up straight, head on. He's the next military man, so imagine the training he will give you. He said, walk ahead, and the world will walk with you. Cry, and you cry alone. I have actually known 2 relatives and 1 or 2 close friends, who had cancer, and one of them had very aggressive cancer. And I was shocked to see I was rather shocked to hear what they went through, but so proud to see how they handled it and how they've come out of it very strong, and they're living a normal life now. It was very, very interesting to see them, One day, I used the toilet, and then normally I'll just flush and walk out, but don't know what made me look into the bowl as I flushed to make sure I clean, and I was shocked to find traces of blood. I looked again. Blood? I said, okay, that's not very nice. But I thought, okay, what should I do? Should I check? I said, okay, better not play the fool. So I went to see my GP first. And he said, okay, you may be having piles. So he gave me medication for 3 days. He said, only 3 days. After 3 days, if it still persists, you come back here. I was very sure it's only piles, what is there to worry about? So he gave me the medication, and it's not very interesting, and the medication for piles, I'll tell you. But anyway, 3rd day, 4th day I used the toilet, it was okay. Then, but evening I had to use again, and it's with motion and not urine, Blood came out again, and this time was a bit more and darker. I said, okay. And lucky the clinic only closed at 9, I rushed straight. He didn't ask me any questions. He gave me a letter and said, go and see the doctor in SCMC. And you will go tomorrow morning, and don't hesitate. And my son was with me, so he said, do not hesitate, because this is a bit more serious. Actually, when a doctor tells you that you think you're going to play the fool. So I decided to go. That's what I did. Coming back home, I was like, you know what, maybe I'll just go and see another GP. Maybe, he wasn't too sure. I needed 1 more treatment of piles medication. Thinking about it. But my 2 children were like, Mom, you got nothing to lose. Go. And I thought to myself, I've got good medical cover from my insurance company. Why not I go? Just get it checked. If nothing, you never lose anything by going. Get yourself admitted. Let them do all the necessary thinking, and why not? They check you up nicely. So I decided, and I am glad I made that decision. Really glad. I said, okay. He had to do a checkup, and he said the scope showed a small growth, but he needs to check it. But he did a diagnosis, and he said it's malignant. When he used the word malignant, it was like, of course I was shocked, because I thought me and cancer were two worlds apart. But you know something, even then I held my strength because my children were there. My daughter was at work, my son was with me, and he looked, I said, okay, so let's see what to do. Inside I was breaking up, I was crying inside, but I had to smile outside. And because you know something, you never related to yourself. And I was like, the big C, it has actually hit me. I said, okay. So I asked the doctor, what next? And he said, okay, I have to do a scope to see. And guess what? I was told it's stage 2, not just stage 1. Okay, just only stage 2. So came out. I told him to give me 1 day to process the whole thing. And it was not easy, I'm not going to lie, to find out that you actually have cancer because, but then, you know what I did? I recollected my relatives and my friends who have survived and they're living a good life. And I said, if they can do it, I can do it, come on. And I think that was a bit more aggressive. So I said, okay, what next, doc? And took the journey forward from there. And I went on. Okay, you've got cancer. My first thought was, am I going to die? Then I keep thinking of my 2 children, I said, they lost their father in 2002, and this is 2010, 8 years later. Come on, you can't. But hey, then I started hearing and reading online about a lot of people who died because they couldn't survive cancer. So I said, nah, I remembered what my father taught me. Fear will only conquer you if you let it. And that was my thing. I wasn't going to let fear take over my life. Hey, this is my life. So I'm going to live it. And I decided, follow what medical advice. And was I scared throughout my journey of chemo and radiation, knowing whether I will survive? I was. But I said, I will get through it. That was what my only motto was. And every day I tell myself that I can, I will, I can. Remember the little choo-choo train? I can, I will, I can, I will. And I did it. I got over it. Of course, first thing I asked was, why me? Haven't I been through enough? 2002, my husband. 2004, my father. 2005, my sister-in-law. 2008, my mother. And then now 2010, I got cancer. Isn't it enough? Why me? Then I thought, okay, cancer was supposed to visit my family, my immediate family. I rather me than those who mean a lot to me. I can handle anything for myself, but I cannot take it if anyone close to me, especially my 2 children. If anything were to happen to them, that would break me, not cancer. Went back, saw the doctor, and he told me what would be needed would be first to do a surgery to remove the tumor, followed by chemotherapy and some radiation sessions. And he told me it's going to be a long surgery on my stomach to cut across and remove the tumor. And it will be a process that will require some patience to handle because my cancer was colorectal cancer, so my colon and rectum affected. So it's going to mean I'm touching a colostomy bag by my side and my motion to be collected. And he explained to me a little bit of the complications and all that. But he says, for now, you have no choice. You have to do it to remove the tumor. And we'll see after that. So I said, okay. Radiation, a few sessions. The radiation, I go through a tunnel. I'm claustrophobic. I don't like it, but it's an entire treatment process. And then chemo. I asked him, chemo, what kind of chemo? So he said, you hold on, that one the oncologist will explain to you. I'm the surgeon, I'll do the surgery for you. So I said, okay. So I prepared myself mentally, yes, emotionally, I was like, I'm going anesthesia, I'm going to be cut open. I'll wake up, right? I won't sleep permanently, right? I said, yes, I said my prayers, everything. I said, okay, lah. Trust my doctor. That's what I did. I just trusted my doctor. Because before I went in for my surgery, I pray every day, right? Maybe the day I prayed a bit extra, nah? Just told the big man up there, listen, don't be naughty and call me now, I'm not ready, yeah? My children still need me around. So, and just maybe for mental strength, let's put it this way. Because you see, I have to be strong for my children also, that was my biggest battle. And every time I came out from surgery and all that, and then chemo, whenever I had my chemo, every morning, I am basically a praying person, not a temple-going person, okay? I don't go temple every day, but I pray at my altar. I believe in my personal prayers. And that pulled me throughout this journey, and even today it does. I'm quite strong about that. Surgery was over. I woke up, I had a little colostomy bag here. I said, okay, everything is over, now prepare myself for my chemo. But I didn't realize one thing, you actually collect your motion in that bag, and that was a shock for me to understand. Actually, you see your motion being collected there. You think it's easy. I pray none of you go through it, but yes. And then cleaning that bag and learning how to do it. The nurses were very nice. They taught me how to do it the first time. But then when you're on your own, you do see it. I had emotional breakdown when I see that being collected. But after a week or so, I got used to it. I said, okay, it's my motion. We should have shared of it. And I cleaned it. And then chemo. I was told, I said, I don't want intravenous, I don't like all that injection. So my doctor said, you can take tablets. I was very happy. I took tablets. But you know what was the side effects I had? My skin, my palms, it became so dry, I could actually peel skin. I couldn't even hold water. To wash my face in the morning was a challenge. I used to put a lot of, I see my doctor, but she told me that's a side effect you have for that. So of course, a lot of lotion, every day, coconut oil, some baby lotion and all that. But for 2 weeks when I take, then after a 1 week reprieve, I don't take medication, So that time, it doesn't recover that, but because after that again you're taking it for 2 weeks. It was a journey, but I got through all that, right? Now my hand's all right. Okay, now that I was going through all this, I realized I started reading more. I Google, special colorectal cancer. What happens? Does it recur? The most important thing in my head, does it recur? How many people have died from it? And all that. Then I thought to myself, hey, I'm not going to read about people who died about it. I just want to find out what could have caused it. And very, very difficult, you don't get an answer for it. They give you this and that and all that, so I said, okay. And I talked to 1 or 2 relatives and all that when they talked about their cancer. I talked to those who have survived positive things. It was nice because I found that I belong in the club now, right or not? So, but we all cheer ourselves up, and did I deliberately avoid reading about deaths and all that? Yes, even today I do. I don't like to read about wars and all that, and I don't like to hear about people dying from any illness, and related to cancer, I never look at it. Maybe I'm not covered, but that's what I am. But I read a lot. I find that even now, if my body has a little bit of change, I do read related to anything, and I'm a bit careful now. I read a bit more positive things. I try to information. I'm trying to find out information. That's what I do. Okay, I was nearing the end of my treatment. First stage, no more radiation, so no more going to the tunnel, which was hurrah. Then I had to undergo another surgery to remove the bag. my doctor told me it's a minor surgery to remove and attach back the colon, and the body will take a little bit of adjusting and all that. So I said, okay. And I finished that, came out of anesthesia. Then I had my final dose of my drugs for my chemo. And my doctor told me that I think you've completed your course, your treatment, all your results show good, and you don't have to continue anymore. You know, that feeling of having struck lottery of R1,000,000, even that cannot compare to what you feel when they say it's over, you don't have to come back to the hospital. But of course, once a year I have to go for my colonoscopy checkup, but that's okay, it's just a treatment. I just go check in one day, do it and come back, just to make sure everything is okay. But no more chemo drugs, you know what that is like. And that was how I felt, really good and really relieved, happy. Yep. I know my children were worried, okay, that I was going through treatment. My siblings, they were also worried about what I was going through. And I felt guilty that, what did I do to get this and to cause them all this concern? But, well, I've got it. There's nothing I can do but handle it as best as I can, follow all the medical rules and regulations. Whatever I was told to do, what I was told not to do, I followed to make sure that I made their life easy and, of course, my life easy. Did I feel guilty? Did I feel bad and sorry? Yes, but guilty, I wouldn't say, because I didn't do anything to deserve it, I think. But, you know, I did feel a bit bad what they had to go through, seeing me go through all this now. Well, you know, while I was undergoing my treatment, of course, I spoke to the big man up there and told him, look, I'm asking you to take care of me, because basically for my children. And, you know, I want to get through this healthy, very healthily. I don't want to be sick and be a burden to them. Okay? And you know what I promised him? In 2002, when my husband passed away, very healthy man of 50, he went to work and a heart attack at the office. No history of heart attack, you know, medical history, and he died in the office. He came back in a coffin. I used to scold God every day in my prayers. I pray and then I scold him. You are very cruel, you don't understand, you don't know my pain. So I told him, okay, I think I've scolded you enough. Okay? Henceforth, you bring me out of this, leave me around to be with my children, I won't scold you anymore. I don't know whether it was the right bargaining power, but I did that, and from that day till today, I've never once questioned why that happened in my life, the loss of my husband, why that happened. It was meant to, I'll take it. And that was my bargain with him, I know. I thought my life ended when my husband passed away and I got nothing, you know, everything is like that. But you realize there are bigger challenges in life, and I thought, you got cancer, you get a good perspective of what can change overnight. So I had now learned to appreciate every little thing I do. I enjoy my life. I make sure I have fun and move on with my life. I've learned to enjoy my life, let's put it this way now. I'm not going to sit in a dark corner and regret about what has happened. What's happened is finished. Future is yet to be enjoyed, and that's how I'm living my life. Don't let cancer take over your life. It can, if you let it. It's like a crawling thing. It will slowly take over your entire being, and then you'll find that, I've got cancer, what do I do? Why don't you rephrase that, say, I've got cancer, so next what? And move on and see, because one thing I'll tell you, what I did again and again, I did not let the fear of cancer take over my life. Like I said, what my father taught me, fear will only conquer you if you let it. You conquer fear and see it'll run away from you. And see how easily you will overcome this. So be brave there. Do not be frightened of the big word. It's not a big C, it's just a disease, another disease that can be treated. That's it. That's all I have to tell all of you out there. You know what? I'm happy now. I'm healthy, I'm traveling. I'm going to Spain soon. I've got a grandchild in London. I can travel, I can see people, I can move around the way I want. I'm so happy with what I have right now. And actually, I can go enjoy, drive around. I'm happy doing all that and no complaints. So actually, I enjoy that. Flying off here, enjoying a trip here. I'm going to Spain soon. And I think that's what makes me happy. I can travel, you know, and I can move around on my own, independent. Yep.